So, you've got back pain, and now you're at that classic fork in the road, right? Do you go to a chiropractor for that satisfying crack, or do you head to a physical therapist for, well, for what feels like a lot of homework? It's a super common question, but what's the real difference? And more importantly, which one is actually going to fix the problem without, totally draining your bank account? Let's get into it.
First things first, let's just start with this number, $3,150. That is the grand total that one person spent on 6 months of chiropractic care, only to end up with the exact same backache they started with. So yeah, the stakes here, they're not just about your health, they're very, very much about your wallet.
And this quote just perfectly frames our whole conversation today. It's witty, but it's also kind of a warning. We're going to use this personal story as a roadmap to really understand these two professions, the costs, the science, and at the end of the day, how you can avoid making a really expensive mistake.
All right, so to make the right call, you first have to get the fundamental split in philosophy between these two professions. I mean, they approach your spine from completely different angles.
Okay, so here's the absolute crucial point. A chiropractor generally focuses on the structure. They're looking at your spinal alignment and treating the symptom. And it's mostly a passive treatment. You lie on the table and they do the work on you. A physical therapist, though, they focus on function. It's an active treatment. The whole point is to fix the root cause by teaching you how to move properly and build strength so you don't even need to come back.
Now we have to talk about that famous pop. It feels so good, right? Well, it has a fancy scientific name. Tribonucleation. All it is really is gas bubbles being released from the fluid in your joints. Now that pop can provide a sense of relief by kind of resetting the pain signals to your brain. But here's the key word I want you to remember: temporary. It's a neurological trick, not a bone being permanently shoved back into place.
Now contrast that temporary pop with the PT approach, which is all about motor control exercises. This isn't about a quick fix, not at all. It's about the slow, steady, and sometimes kind of boring work of teaching your deep core muscles how to do their job and support your spine. This is what builds real long-term stability, so you don't need that pop in the first place.
So we know the theory, but how do these two paths actually feel when you're the one on the table? Well, the patient experience is, let's just say, dramatically different.
This is what a physical therapist told the person in our story, just after watching them walk around for a minute. And it's such a fantastic line. It perfectly captures the PT's whole diagnostic approach. They aren't just looking at the spot that hurts. They're playing detective, looking for the real cause, which could be anything from weak glutes to tight hips.
And this difference in feeling is so important to understand. That chiropractic adjustment can give you an immediate high, right? A satisfying release. But because it's often temporary, it can easily create this cycle where you feel like you need to keep going back. Physical therapy is the total opposite. It's slow. It's humbling. It's work. You leave feeling tired, not euphoric. But the whole goal is to get you to the ultimate prize. You just stop thinking about your back altogether.
Okay, let's talk about the money. Because the price on the sign for a single visit, it really doesn't tell the whole story. The true cost of care is way more complex than you might think.
So at first glance, you see the chiropractor's cost and think, hey, that looks cheaper. But you've got to look closer. The visits are way shorter, sometimes just 10 minutes, and the recommended frequency is often way higher, like 2 or 3 times a week. This is exactly how that lower per-visit cost can quickly spiral into a much bigger bill over time.
And this is where you really see the value math play out. If you calculate the effective hourly rate, what you're paying for an hour of a professional's time, the picture just completely flips. You could be paying the equivalent of $360 an hour for chiropractic care versus maybe $120 an hour for a doctor of physical therapy. You're just getting way more dedicated one-on-one time for your money with PT.
And here's a huge warning sign: the package trap. A lot of chiropractic offices will try to sell you a big package of visits up front, for a discount. It might sound like a good deal, but it can lock you into a super high volume of treatment that might not even be medically necessary. It kind of puts their revenue model ahead of your actual recovery.
Okay, so we've covered the personal story and the financials. But what does the hard, objective, evidence-based research actually say about which approach works best?
The data here is actually pretty clear. For that sudden, acute pain you've had for less than a month, spinal manipulation can give you some decent short-term relief, about the same as taking an ibuprofen. But for chronic, long-term pain, well, exercise therapy, the heart and soul of physical therapy, is the undisputed winner for creating lasting stability. It's not even close. And what's more, starting with PT is consistently linked to lower healthcare costs down the line. Fewer MRIs, fewer injections, fewer surgeries.
All right, we have covered a ton of ground. So now, let's put it all together. We're going to synthesize all this into a clear, simple guide you can use to make the right call for your own situation.
This is the million-dollar question, isn't it? Your back goes out, you can barely put your socks on. Who do you actually call first? Well, the answer really depends on what kind of pain you're feeling.
Let's make this super simple. Here's your decision matrix. If your back just feels mechanically locked up and the pain is right there in the center, a chiropractor might give you that quick, short-term relief you're looking for. But if you have pain shooting down your leg, what they call sciatica, or a chronic issue that just keeps coming back, or you feel any weakness, go directly to a physical therapist. And of course, for any serious red flags, like numbness, a fever, or a recent injury, your first call is always to a medical doctor. No exceptions.
Now look, both of these fields have fantastic practitioners, and they have some bad ones. So you have to know the red flags. For a chiropractor, if they're pushing a long-term contract on day one, or they claim they can cure things like your allergies, run. For a PT, if you're spending most of your very expensive session with an assistant or just sitting on a heat pack, you are absolutely not getting your money's worth.
So, what's your next move? Here is a concrete plan you can literally do in the next 15 minutes. First, pull up your insurance benefits online. Second, look at the actual numbers. Compare your copay for rehabilitation services, that's PT, versus chiropractic. And third, book the right appointment for your type of pain. But go in with a plan. Set a firm limit for yourself, say 3 or 4 visits, and then seriously reassess your progress. Because remember, the ultimate goal isn't just to rent temporary relief, it's to invest in a permanent solution.